Welcome back, everyone. You have the same tie on that you had in the first part of this. We're not going to fool anybody. This is Angelo Calbone, President and CEO of Saratoga Hospital. And we were in the middle of a very, very interesting conversation. So we decided, instead of trying to run through just the greatest hits, that we were going to come back and delve more into the conversation that we were having. We kind of left off, Ange, with the investments. We were talking about Wilton. However, there have been some substantial investments right here at the hospital itself.
Yeah, significant investments. To understand how this happens, we've been successful in many levels, and one is financially. We're fortunate to be in a growing community, in a growing county, and that's helped us do many things that institutions, maybe in some struggling regions, couldn't do. All of the money we make, we're not-for-profit, which means we don't have shareholders. No one gets to share in the success of this organization other than the community. So these investments have been our good fortune to be able to be financially successful. We turn that money around and reinvest it. Here at the hospital, I won't remember all the investments that we've made over the years, but we have really, in a sense, rebuilt the institution. It needed updated because it was just aging, and it also needed to get bigger because to accommodating our growing community. We have a new emergency department, a new ICU. We renovated many of the inpatient floors, our cancer center, and again, I could probably step through every floor and every section of the building and note significant investments. Tens of millions of dollars have been reinvested in this organization, which comes back to that larger point. This is the only place hospital-level care can be provided. So things like our two new Da Vinci surgical robots are here because they are used primarily for inpatient surgery. Our cancer center has expanded with the second LINAC. While that could be provided somewhere else, it's here at the hospital campus, and we've continued to invest in that and grow. So the investments have been equipment, but some of our largest investments have been really changing the building out. It wasn't that long ago that our intensive care unit could only hold maybe 8 or 10 patients. Now we could hold probably up to 19 patients. Our past emergency room probably could have accommodated, and these numbers, while not precise, are generally right, in the teens. Now we could probably manage up to about 40 patients in rooms. So we had to get bigger, and while we got bigger, we in a major way upgraded the quality and the technical capabilities of this campus. So you're right, there have been significant investments, many of which I have forgotten. Our staff has grown right along with that. Again, it wasn't that long ago that we had 1,300 and 1,400 employees. Now we're approximately 3,000 employees at Saratoga Hospital.
Wow.
That creates a major impact in the community. We are not only a healthcare provider, we are a large economic engine. Our annual budget this year probably will be somewhere around $425 to $440 million. So we contribute many ways in the community. Our employees live here, they buy here. While many of the things we use can't be purchased locally, a lot of the things we use are purchased locally. So in many levels, I think having this hospital in this community has been a good investment, and I think we've been a very good neighbor, helping to support and grow this community.
Sure. That's evident not only in what you say, but also in what you do. You know what I mean? I hear a lot about it. You're before the planning board and the zoning board right now to create a medical office center on property adjacent to this property. It goes well beyond the fact that Saratoga Hospital needs to expand and purchase this property. I want to dig into that just a little bit, if it's okay. because there are a lot of benefits and a lot of things that our viewers may not know in terms of why you would want that piece of property.
Yeah, so let me step through kind of a series of kind of points that I think would be important for your audience to understand. Some years back, we made the decision strategically to create and invest in a hospital-based medical group. We now have essentially the majority of our medical staff is employed by the hospital inside of that medical group. It is a growing, successful, thriving group of physicians. That model of care, bringing them together to collaborate with themselves and be a partner inside the institution, has really allowed us to recruit top talent. Good physicians like to work with good physicians. Good nurses like to work with good nurses. So as that has grown and built and we've attracted great talent, as I like to describe, we now have momentum. We're now attracting physician talent to this community that I think 10, 20 years ago would not have given us a second look. A large part of that is this medical group that they look at and conclude, I'd like to practice in a group of physicians like that work closely together and collaborate. One of the things they turned to me some years ago and asked, this is good, we're happy to be here, we love this relationship we have inside the institution. We would like to be in a singular structure, the specialty physicians I'm talking about, so we can work physically closely with each other and collaborate to a higher degree. Right now we have them pretty much flung all around town in rental spaces that we own. That's expensive for the hospital. We're renting space all over the place. Each office needs reception staff, a waiting room, and back office functions. So there's an efficiency of bringing them together into a singular building. They're not necessarily thinking about that efficiency. I am. They're thinking about it in the mode they'd like to practice. When we look at where we could put something like this, the answer, there's a limited number of options, to be honest with you. We've had some suggest we should put it here on the campus, in the parking lot, build up on top. As we've talked about all through this discussion, it would be very short-sighted to take any space in and around or on or inside this institution for a service that can be provided off of this specific site. This is the only place we can provide inpatient care, and we've already nearly outstripped the capacity of our structure. So that's just not a good idea. So then that leaves us with where, continued where. The physicians would like to be physically close to the institution. They can use a lot of time in travel time back and forth from offices to hospitals. We want to minimize that and get them close. But once you reach that point, there's not a lot of options of open land around us. The piece that we purchased back on the end of Myrtle was few if not the only piece of land that we could have had access to. So you're going to hear us talk more about this.
Sure, I bet. I encourage our viewers to know more about this. If you watch the Saratoga City Council meetings on our platforms, you'll get to know more about this and support the endeavors that he's talking about. We've got only a couple of minutes left, Ange. I want to talk about heading north. Exit 18, those of us that live up there, we know that the plans, and I think this is kind of breaking news in a way also, and we do a lot of work with Hudson Headwater, terrific organization. It seems very natural to me, especially after talking to you, that you would partner with them on a facility at Exit 18. Again, really furthering what you were just saying about reaching out into the region.
Yeah, and this is a good example. It wouldn't have been that many years ago, this would have seemed as an odd step for us to take. We own the property at Exit 18, the old Carl Lars, as everyone up there knows it to be. The reason we made that investment is that the very physicians that I just talked about have growing practices and to an extent from patients from the North Country. So we've had our physicians suggest to us they would like some office locations a little further north so that the practices they're developing up in the northern regions could be a little bit better managed. that was part of the impetus for taking that property and thinking about developing it. As we started moving through the planning process, we looked at what we could do there and saw it as a natural location for urgent care, some medical diagnostics, and physician offices. During that same period of time, we've come to know Hudson Headwaters a lot better. They've developed closer relationships with our medical group, have referred cases into our specialties. They do wonderful work up in the North Country, providing primary care. Without them, many people would not have access to care. So in these conversations, we asked ourselves a question in one of these meetings. Would this be something that Hudson Headwaters could participate in? Long story short, Hudson Headwaters will be leasing a part of the building to operate urgent care, which is very close to primary care. That's their niche. They do it very well. So we're going to let them do what they do well. We're going to have specialty physicians in offices located on the property and provide some medical diagnostic work. We think it's a good collaboration, brings all of our organizations a bit closer together, and plays to our strengths.
Well, thank you so much, Ange. It's
Thank you.
great to
Thanks for coming.
see you. But you could talk about this for hours, I know. But this is the future of healthcare. You know, if you follow this conversation, you listen to Angelo and understand that reaching out into the community, forming partnerships, collaborations, investing in the community is the future for healthcare. So it's great to see you.
Thanks for coming. Good to see you.
I'll look for you on the highway.
Okay.
Private joke. You know I was going to sneak that in there, didn't you, Pete? To see this interview again, both interviews, please go to our website, looktvonline.com.